Welcome to another episode of What Brings You In Today. I'm Erica Bennett, and we just want to start off by thanking our listeners. If you haven't already, please like and subscribe so you can make sure that you're staying abreast of all of our new episodes. And then, of course, if you have any questions that you want to share with us or any topics you want to hear about, please let us know, and we'll be glad to try to line someone up to talk about that. But today we're here with Dr. Guy Oliveira. He's a cardiothoracic surgeon. And so, Dr. Guy, what brings you in today?
Hi, good morning. Well, first, thanks for having me here. I think for us to just talk about heart disease or lung disease and get more information for the public out there.
Sure. Heart and vascular disease is very prevalent in our area. So very important topic, but let's start by just learning a little bit about you and your background.
Well, I was born in Brazil, but our family is like Italian as well. Grew up there, did medical school there, ended up going to Canada, here the U.S. and Portugal to do some observerships or rotations in surgery and heart surgery. And then when I finished medical school, I joined the Army as a doctor for 2 years in Brazil, and then decided to come here to the U.S. Went first to the Mayo Clinic in Rochester, did a year of research, and started residency there of general surgery, and then moved to UNC in Chapel Hill, and then last in Utah for Cardiothoracic fellowship, and now I'm here.
Okay. So tell us about that decision to specialize in the heart and lung and all. What led you to that?
Well, I think it was funny, when I started medical school, I said that I'll never do surgery. I don't know, I thought it was... But then when I started rotating and seeing things and, I guess the changes you can make, by operating and then restoring their health, I was lucky then to have a very good and famous surgeon in our city that was a heart surgeon. I was able to shadow him and work with him for a few years, and then came to Boston and Toronto to do heart surgery rotations. But I started general surgery, and then I was like, well, unfortunately, I think, and maybe that happens for many specialties, but I think on the either medical student training now or residency training, the general surgery people don't go through cardiac anymore too much because it's not part of the requirements. Yeah. So I guess during a few years of general surgery, I was trying to find something that I liked, but I wasn't in contact with heart surgery for that time. But I was like, well, there's nothing I really like. I liked everything, but it was nothing really sparked me. And then we were able to get me to do heart surgery by the third or fourth year again of residency, and then I was like, yep, that's what I want to do. Yeah. But I think mostly some of the changes that you can do either with heart transplant or other things, right? You can significantly improve their lives. So
what is that like, looking at a live heart, beating heart that you are going to work on? What does that feel like? How do you approach that? Well, just mentally, from just a surgical aspect, but from a human aspect too.
Well, I'm sure in the beginning it was probably scary, but as if anything, I remember in the beginning of residency training, and you're in the trauma bay and a bad car accident or gunshot wound comes, and you're like, oh boy, are we gonna be able to handle this, right? But I think with the repetitions, with training, with everything, by the end of some years there, you're like, well, there's nothing that can come that we can't at least stabilize the patient. But I think with the heart is definitely fascinating. I remember the first heart transplant I've done, and it's, I guess, something that not many people know, but even when we remove the sick heart, right, it still keeps beating in your hand for a little bit. So that was wow, right? And then I guess to see that bad heart, distended, sick heart, and then you put a new one, and that was very, very impressive to me. But but I guess on a daily basis, yeah, I mean, I guess every surgery is humbling, and you need to be doing your best, because even with images or tests and everything, sometimes there are things that you get surprised every time, but definitely it's a privilege, I guess.
Yeah. All right. Well, tell us a little bit about what kind of surgeries you do, like what different things can be done on the heart.
So, well, I guess in general, then, as a cardiothoracic surgeon, like what we do is, I guess, basically anything inside your chest or thoracic cavity and in the thoracic wall. So a cardiothoracic surgeon could do anything from like heart surgery, lung surgery, or esophagus, and of course rib fractures or stuff like that. In terms of the heart, I think, well, the most frequent probably we do is coronary artery bypass graft, right? Like if you have a blockage that either gave you a heart attack, or if luckily you found out before you had a heart attack, and we can bypass those lesions, or if any of the valves of the heart are not working well, we can replace them or repair them. If your heart doesn't beat in a regular way, that, there's types of ablation, like kind of trying to reset the normal heart rhythm. And of course, then there's, I guess, more advanced things like devices that you can put on the heart to help beat because it doesn't work well, or eventually up to heart transplant, right? Yeah, I guess those are.
So I know obviously surgeons have to go through a lot of school, and you go through a lot of training, years and years and years. How did you see things advance even during your training? Did you see a lot of advancements take place at that point, or how do you feel like technology plays?
Well, definitely. I think I started medical school like in 2007, 2008, like, and this August is going to be 12 years that we finished.
Yeah.
So definitely, like, at least I guess to say in heart surgery, right? Like, or then we can talk about lung surgery as well. But, back in the day, things were very, let's say, maximally invasive, right?
Yeah.
Like big incisions to get the vein from the legs. To do the bypasses was like you open the whole leg, right? And it was something very morbid, like, right? There's a high risk of infection, of issues with the wound healing, and nowadays we get the veins with a small cut and a camera and like instruments that you basically just do incision very small, right? Like a couple inches instead of the whole leg. And even, I guess, in the heart, all the devices, right? Like when heart surgery, I guess, began, like they could only do one procedure because they didn't have how to stop the heart or give blood and everything for the rest of the body, right? Like, and so
Yeah.
And it's, I guess, surprising to think that nothing like that came before the 1950s, right? So it was like 1950s to 60s that like they developed the heart lung machine and all that stuff. So I think definitely we came a long way, and now more and more like it's robotic instruments getting involved, or minimally invasive, like smaller cuts to prevent, to facilitate healing and everything. And then I guess that's the same for lung surgery, right? Like back in the day, it was also a big cut between your ribs, like, and nowadays we can do it with tiny incisions in the robot and camera and all, and I guess that helps a lot for the patients and everything.
Yeah, absolutely. Let's talk a little bit about lungs and lung surgery. What would spur someone to have a lung surgery?
Yeah, so I guess we can probably separate in benign things that like in malignant, like cancer, right? But like I think benign things that we see often is like people that have, for some reason, they have like maybe bubbles, or we call blabs, on the lungs, and changes in pressure or a heavy cough or something, that those kind of can burst, or and then they have air inside the chest, right? Like we call pneumothorax, and it's usually more common in very like young and thin, tall males, but like can happen, I guess, with anybody. And that air leaks and pushes against your lung, so the lung cannot expand, right? So those are one of the things that we do often. Sometimes just a tube fixes it, but sometimes you have to do surgery. Or infections on the lung, like after pneumonia. And if sometimes we see, unfortunately, people that try to toughen up and like, or didn't seek care for weeks after pneumonia, and then they come with a lot of fluid around the lungs that's infected as well. So we need to drain that and clean everything. Lung cancer, of course, right? Like, and yeah, I think those are the main things on a daily basis, like that we see. But of course, there's some different things, right? People that smoked or have bad lungs the whole life, and the lung is so dilated and big that you have to remove part of it to kind of help the breathing, because they're super
and that's
distended.
Fascinating to me that you can remove parts of like the lungs and then still your body can function without.
So and that's a discussion we have every day in clinic when we see patients like that. You know, we test their lung function, and we get there's some cutoffs that, like, okay, if your lung function is below this, we shouldn't be doing surgery because you're going to need oxygen for the rest of your life. But it's actually interesting that the right lung is divided in three main parts we call lobes, the left one and two. But inside those lobes, you have small, what we call segments. So sometimes it feels like, oh, you're removing half of my lung, but like actually that upper part of the lung is just 3 segments, and in the big picture is like 3 out of 19 segments. So right, it's not that we're taking, it's a big volume, but like it's not like necessarily that we're gonna impair your breathing if your previous function was normal, right?
I guess I just think about it as being like 2 big lungs, like, and if you're taking a section, it's like I never thought about it being different sections within the greater lung, I guess, which is pretty cool that you're able to do that. As far as prevention goes, I know it's different very similar, I guess, for cardiac and lung disease, but what are the best tips that our listeners can take to not have to ever see you?
Well, that's what I always, when we meet people or patients or stuff, like, I hope you don't need me, right? I think, unfortunately, there's people that just are born, right? Like, it's genetics. Not that we can point a specific gene, right? But like it's genetics, right? Like, we see very young people that are active, are athletes, and they have heart disease, right? But overall, we know that smoking is pretty bad, right?
And is vaping equally as bad? Like how?
So the studies, I'm not entirely sure exactly what they say, but the studies show that basically vaping is the same as you're smoking like 10 or more cigarettes, right? So and I think the problem with vaping is, of course, maybe they don't have as much nicotine as a cigar or something, but I don't know if it's that controlled, right? So, like, you can be getting a vape from, and you don't know which other
quality control of the actual
substances are there, right? Like, so I think the problem is that maybe they're putting something, other substance that we don't know that might be causing more harm as well, right?
Okay.
And that's a problem now with younger people, right? Like, there's a lot of like teenagers or young adults like vaping and in a good amount, either because it looks cool, it's like socially, they think that they have to do that, or
and to your point, it was positioned as having like less nicotine in it and things like that. So, but not really if you're not considering the full picture of which most young adults are not.
And we see then a lot of like very bad lung disease in younger people, like if eventually they get a CT scan or something and thought to be caused by vaping. But back to that question. So like, I think, of course, having a healthy diet, be moderate with fried things, fatty food, and exercise daily. I think we know that if you exercise 30 minutes a day, if 3 to 5 times a week, you already improve significantly your heart health. And so I guess it's kind of what everybody kind of knows, but it's very
I
hard to
know.
apply, right?
It's easy to tell people
Yeah,
what to do, harder to do it yourself.
yeah.
Let's talk about the collaboration between the different departments, the different areas, because heart and vascular, that's kind of a big field. So talk about maybe how you work with some of the different areas within like cardiology and electrophysiology and even pulmonology, maybe. Like how do all those complement each other? And then what's the importance of being able to have those different specialties to kind of connect the
Yeah,
care?
definitely. I think is it's very important to have all those specialties together. A lot of things that we talk about nowadays, we talk about the approach as a heart team, right? Like it's not just the surgeon or just the cardiologist, right? Like so, for instance, the TAVR, right? The valve that we can replace through the groins, right? Like that, a lot of people seek for that because, well, you don't have to open my chest to go home the next day, right? But that is something that not even I think the heart team is good to approach to. I give my opinion as a surgeon, what's the best for the patient. The cardiologists give their opinion as, in their view and their training. But also, per the laws and regulations, both me and a cardiologist needs to be there during the procedure, right? Like, so here, Dr. Siebold and I do them. And I think it's very important, right? Because he sometimes see patients and I see patients and we have like, well, yes, we could do through the groin, but is that the best for the patient, right? Like in terms of nowadays we talk a lot about like lifelong management of heart disease, right? Like because some valves last some time, right? Like the others can last longer. So like what's the best for the patient, right? So like I think it's very important to have that connection. And then the same happens with, they do a heart cath, find the blockages, and they, if meet some criteria, they call us because, hey, this patient should have surgery instead of stents, right? Or you mentioned electrophysiologists is the same thing. Unfortunately, there's surgeries that we do, or even before that because of the disease, the patients have heart block and need a pacemaker, right? Like so, we're always kind of in connection with them as well. And then to recovery from everything, right? Like then you need a good team of physical therapists, rehab, right? Like and all that to like set up all the patients to get the most success after.
How do you help alleviate fears and anxiety and that can come like with your patients of undergoing a surgery?
Yeah, I think it's, heart surgery is tough on that point, right? Because it's not like kind of simple thing, right? Like, and so my mom was a nurse, and then my dad was a doctor as well. So like I grew up like seeing how I guess they care for patients, and with that saying of like you should take care of your patients like you wanted your parents to be treated, right? Like so, I think you just I just try to, I guess, of course you try to explain everything, and sometimes it's too much, right? It's too much information, but like at least I encounter, I think the first time I've seen that was at the Mayo Clinic, and I since then I adapted, and like I have my drawings, of the bypasses, where is your blockage, what we're gonna do, or this is your valve, what we're gonna do, and that's a picture of your lung, and this is where your cancer is or stuff. And I think going through them with that and this visual picture is all like helps them understand much better what they're going through, and like, and I guess just then being there for any questions, any issues, but in a close communication with family and everything. But.
What's the most rewarding part of your job?
Well, I think just being able to help people, right? Like it's good, like seeing people in clinic, after a month or even earlier, but like after surgery, and they're like, wow, like I never had this much energy in my life. You just assume that like, oh, you're getting old and things are normal, right? Like to slow down, but like sometimes it's your valve not working or your heart not, with the blockages on the coronaries, and after you operate on them and they're like do well and improve their quality of life and all that. I think that's very rewarding.
And so kind of piggybacking off of that with, someone being tired all the time, and I guess the importance of having a primary care provider and like actually tracking your, all your levels and all your, just getting that primary care. Because ultimately, do you get referred? I mean, it has to pretty much start there unless you're coming in the ER with like an emergency situation.
Would be either the primary care or a cardiologist or a lung doctor, right? But I think that's like, it's extremely important, right? Like, and even after surgery, like, it's important to keep following with them to control blood pressure, to control all the things. But yeah, I think having a primary care, having, continuous care, and of course there's different diseases that have screening that happens at different ages, right? Like if you are a smoker or, when you're like 55 or something, you should be getting annual CT scan, right? Like, and that was definitely proven to be not worth it only on cost, but like in, saving years of life or quality of life, right?
That early detection is the best. Okay. Well, is there any misconceptions about heart or any common questions that you get asked that we could clear up while we're on the air?
I think I feel like a lot of people are very scared, right? Like when you talk about open heart surgery, like it's very like still like a very like, oh my God, like what's going to happen with me, right? Like is that, and when we talk and we explain everything and like not only the risks, but like what to expect after the surgery, right? Like I think it's safe to say that for the heart surgeries that we do here, the expectation is that you'll be in the hospital for 5-7 days, right? Like it's not like, and that sometimes alleviates people. And some people leave with 3 days, right? Like if they're meeting all the criteria. But another thing is like about, I guess, the stigma about like the breathing tube, right? Like and how long the breathing tube will stay in and how things are gonna be. But normally, like, and we operated yesterday, but like normally, like it's like this: we operate in the morning, in the early evening, the patient has the breathing tube out. This morning, they're sitting, eating breakfast, and hopefully walking soon, right? So, but I think there's a lot of like the fear of like what's oh, you're gonna open my heart and all, and I think it's a big thing, but I think it became super safe, right? Like of course during the heart surgery we have to stop the heart we can work on it, and there's the machine that keeps giving blood and oxygen for the rest of the body, but everything is very safe, right? Like I guess, of course, there's different people, right? Like different medical problems, but in average, right? Like if most of the patients, we calculate the chance of dying from a heart surgery is probably below 1% to 2%, right? So it's not. I mean, it was never gonna be zero, unfortunately, right? But like it's not like probably back in the day when it was like 20-30% or.
Or more likely to get something afterwards, like you mentioned, the infections and stuff. From having the
I think
invasive.
Nowadays we got to do learn and do a lot of things of prevent infection that significantly decrease the risks and everything. But I think it's just, of course, it's complex. It's heart surgery, but like, and sometimes takes a toll on the patient. But like overall, it became very safe and very. And some people, they're back at work depending on what they do in a month or whenever they feel like, All
right. Well, we also just, recently, a few years ago, started our graduate medical education program, and we have our partnership with Mercer University School of Medicine, and so we're having more medical students here. Mm-hmm. What would you say to someone considering a career in the medical field?
Well,
or what advice would you have for them? Because we do have a lot of those.
I think
listen to our podcast.
I think it's worth it. I think we see sometimes a big shift and I guess not only in the U.S., but like I can tell from Brazil or other places that, ended up meeting people is like, there's a shift or a thought about like, oh, I want to do medical school because of, I don't know, salary or prestige or something. But I think you should do it if you really like it, because it's not easy, right? Like, or as anything you do, right? Like you
gotta really be connected to it to want to keep going.
And unfortunately, we see sometimes people that like started the whole process and halfway like, oh, this is not for me, right? Like, but I think it's very rewarding if you like to treat people and see the outcomes of that, and everything is very rewarding. I think maybe nowadays some specialties could potentially, I guess, be tricky in the future, right? Like now we start hearing about AI and Elon Musk is saying that you won't need a surgeon in 3 years because
we're also not going to need money. Apparently, is what I saw lately.
And Elon Musk says that robots will be doing surgery better than any human, right? Like in this amount of years. But so of course, there are probably specialties that are more susceptible, I guess, to like, some form of AI analyzing images or stuff that can provide a quick answer. But I think still it's a great specialty. Like I said, I think my dad is 83. He was an orthopedic surgeon, and of course, medicine changed a lot from when he went to school or start working and now. But like, I think if you care for people and you want to do good, like it's always going to be a great option.
Very good. Well, the last question I have, I know you haven't been here too awfully long, but you've probably had many meals here. So what is your favorite thing to eat here at SGMC Health?
Well, now I should say something healthy for the heart, right? But unfortunately,
can't wait.
The burgers and the chicken sandwich there are surprisingly very good.
Yeah,
I was like, wow, this is actually really good. So if my surgeries run late and I cannot get the real lunch, I ended up going through burger or a chicken sandwich. But
yeah, that's a good go-to. All right. Well, listen, it was great to sit down and talk to you today. I thank you for sharing all this important information. And of course, we'll link information to this episode so that if you would like to know more or get in contact with his office, we will put that there. And we just want to thank you for tuning in and hope everybody has a great day.